Hi, my name is John Salsberg, and I'm Senior Lecturer in Primary Healthcare Research for Public and Patient Involvement at the University of Limerick School of Medicine. And I'd like to talk to you today a little bit about public and patient involvement in health research. So we'll start by just defining what do we mean by public and patient involvement. And then I'd like to talk a little bit about what's participatory health research mean, and how does that underpin the way we are approaching PPI. And then some of the values and principles that really support the way we do this work. So when we talk about public and patient involvement in health research, we're really talking about it in contrast to the more conventional way that research is undertaken, which is where researchers make all the decisions about the research, such as what they're actually researching, what are the research questions, things like who to enroll, or what methods to use, or any other decision about how to undertake the research. So back in the 1980s, one Indigenous community member had commented on researcher-driven research and said, outside research teams swooped down from the sky, swarmed all over town, asked nosy questions that were none of their business, and then disappeared, never to be heard from again. And he termed this helicopter research. So this was just his particular community impression of outsiders coming in and making all the decisions about the research. So in conventional research, there's often little or no consultation with the people who are intended to benefit from the research, such as patients, carers, or other community members. There's often little or no direct benefit to the community or the participants from the actual piece of research that's taking place. And sometimes there's negative impact on the community or the participants themselves. So what's the alternative to this? So this is where we start to think about, okay, is there a different way to do this where the people who are benefiting from it can actually have a say in how the research is taking place, what the research is for, and what its intents are? So this is where we came to the idea of public and patient involvement in health research. And the definition that we're starting from here in Ireland really comes from a heritage of how it developed in the UK under the NHS over the last few decades. And through that, they have come up with this definition of PPI, public and patient involvement, as research being carried out with or by patients or members of the public, rather than on or about or for them. So it's not even I'm doing this specifically for you. It's you're doing it. We are doing it together. So you are involved in the research process at every step of the way, really right from the beginning of deciding what the research is about, all the way through all the important steps where your input can really steer and have an impact on how the research takes place. And so this definition, as I said, comes from NHS Involve in the UK and has been really developed, over the past few decades of experience of involving patients and other members of the public, first in how the NHS was run to deliver services, and then in how research, more recently, in the last, let's say, decade and a half, about how research itself was being carried out in order to develop the evidence that supports care and services. So, and this definition has been taken up in Ireland by the Irish Health Research Forum and by the Health Research Board. So this is the definition that is being used in policy here in Ireland. So within this definition, there is a typology of different levels of engagement or different levels of the way that people are to be involved with research projects, starting from engagement, then to participation, and then all the way up to involvement. And I don't want to get too caught up in these. I mean, I think it's important for understanding that there are these different levels of being involved, but exactly which word you use for which is really not so important in the long run. For instance, in North America and Canada and the United States, engagement is the term they use for the absolute pinnacle of best involvement. So you see I'm already running out of synonyms to use here. I'm calling it involvement. But involvement is what we use in the UK, and in Ireland is the highest sort of form of being involved in the research as a participant. Although participation is in the middle here, but with the heritage of participatory research, which is really involved, that was the pinnacle. So these words are really interchangeable in many senses. I think more importantly is that you understand what these different levels are, and I'll go through them one by one here, just so you can see the nuances of what the difference between meaningful involvement is and just sort of superficial engagement or even one-directional engagement. So what this typology, what this definition and this three-level typology is calling engagement is where information and knowledge about the research is being provided to the patients and members of the public. So it's being disseminated outwards. So it's researchers telling you what they're doing, telling you what the research is about, letting you know what they're up to, and letting you know what the results are. So examples of this include, having science festivals open to the public, open days at research centers or labs, raising awareness through the media, and dissemination of findings, from research studies individually. So it's really this one-directional transfer of knowledge, engaging the public in that way through saying, this is what we're doing, this is what it's all about, but not really asking for your input in return. Then in this framework, the next level involvement is participation, where people take part in studies. And examples of this are things that you might imagine: being recruited into a clinical trial or other type of research, completing questionnaires, participating in focus groups, being involved in research where you're providing data, where you're providing your experiences, and that is being analyzed by researchers and turned into evidence. But then the highest form of involvement in this particular framework is what they're actually calling involvement, where members of the public are actively involved as in research projects and other, or even in research organizations. So examples of this include as joint grant holders on co-applicants on research projects, in helping identify research priorities and set research questions, as members of a project advisory or steering group, where really you are having a say on the actual details of how the research project is being carried out, commenting and developing patient information leaflets, other research materials, really being able to provide your comment on this material that is going out towards patients and members of the public. Undertaking interviewers with research participants, so actually acting as a research interviewer, where you would be interviewing your peers or other members of the community. And then patients or other carers or other members of the public actually carrying out the research in all kinds of other ways. So any way that you can be involved in actually doing the research, as opposed to just passively, passively just being a recipient of what comes out of the research. So all of this typology really came from the UK experience, and others as well, but really that whole engagement, participation, involvement typology has come from this this experience within the UK. And as we sort of cope with this and try to make it ours here in Ireland, we've decided that if we want to make it really meaningful engagement, because as you saw from the last slide, there's all kinds of different ways that the involvement can be very rich and very deep and really meaningful, but there's other ways that it can just be very superficial and often tokenistic, just asking people to comment on the language of questionnaires or research pamphlets or leaflets. Counts as PPI under policy here, but that's not, or in the UK, and we don't want that to be the case here. We really want the engagement and the involvement to be as deep and meaningful as possible, to have it really help shape the direction of research and what comes out of the other end of research. So as we do that, we want to approach PPI in a way that can really underpin it with the process of meaningful involvement. And for this, we've turned to this rich heritage of research involvement known as participatory health research. And what participatory health research means, and this is a definition, but I'll go through each word of this so you really understand it, is systematic inquiry, with the collaboration of those affected by the issue being studied for the purpose of education, taking action, or affecting change. So it's systematic inquiry. It's real research. You use all the rigor and all the methods and do it properly the way any research would be done. But it's done with the collaboration and the meaningful collaboration of those who are intended to benefit from it, or those who have to actually use the results of it. So the people for whom the research is intended should be co-researchers. And the purpose of it is it's not just curiosity-based research. Oh, we would just like to know something, which a lot of research, is really just trying to fill gaps in our knowledge. This is trying to actually fill gaps in action. There's something that needs to be different in the world, or something needs to change that isn't happening right now, has to happen. And that's the reason we're doing it. So we're trying to take action. It could be for a better health outcome. It could be to provide a service better. It could be to provide education and training to those who need to better be able to cope with something. So it's really to change something or to take action in the real world. And it's done in collaboration with those people who are the intended beneficiaries, and it's done systematically. So it's real research. So when you're taking this approach to meaningful involvement through this participatory process, where does this involvement take place? What part of the research process, excuse me. So right from the beginning, really the very first thing is all the partners to really come to grips with what the terms of their relationship is going to be. So that's the very first place where the partners get a say, is what kind of partnership do we want? How do we want to be involved? You're not telling us, we're all deciding this together. Then once we've decided on that, to decide on what are the research goals and objectives. So what is the research going to be about? How is it going to tackle it? And what are the nuances of what part of this overall question, whatever it's about, is this particular piece of research actually going to focus on? So it's not just of interest to the researchers, it's also to the patients, carers, community members, other beneficiaries. It could also be to professionals, to doctors and nurses who have to apply what comes out of the research. They might want to say in what's going into it. So all of us together have to have a say in what's going into the research priorities and then the way that the research is going to take place. So what are the methods and durations of the research project? Everyone should have a say appropriately in that. The strategy and content of how it's going to be evaluated, how data collection is going to take place, and from whom data collection is going to take place. How we're going to analyze and interpret the data, and then how we're going to disseminate it. So how are we going to take our results at the end and decide what to do with them, decide what language that goes out in, what format that goes out in, who the recipients who needs to hear the results of the research, and how it's going to go into action. And this should be done in both lay language and scientific terms, in ways that the communities can understand it, in ways that clinicians can understand it, that can go to managers and scientists, even funding agencies, but doing it in all the right ways and to all the right audiences that it will have its highest impact. So out of all those, I've taken these two things away. So if you go back to here, oh, I'm not allowed to go back. So just out of all those things that we talked about, for it really to be meaningful, our evidence suggests that if nowhere else, we really have to have deep involvement of the beneficiaries, of the patients, of the carers, of the community members, really upfront in deciding what the research is about and defining the goals. And then if nowhere else in the methodology, then really at the end, after the analysis and interpreting what those results mean. It's so important that you or other partners or participants who really have lived in these situations, lived with particular diseases or conditions, have been involved in caring for people, have lived in the communities where these things take place, are involved in understanding what do the results of our research actually mean, to be able to interpret that, to be able to put it into context. And then at the end, in the dissemination, in getting the message out to those who really have to act on it. So if there's meaningful involvement up front in deciding what it's about, right towards the end in the interpretation and right at the end in the dissemination, that's where you have the most impact for participation, most impact for involvement in making sure that what comes out of the research has the most impact where it's intended. But overall, no matter how you look at it, what's most important is that those for whom the benefit is intended are at the heart of the research decision making. In other words, whatever decisions there are to be made about the research process as it goes along, that you have a say in it. You're never excluded from any meaningful place where there can be important input to how the research is conducted. So the equally important goals of taking a participatory or PPI approach to research are to undertake quality research with a high level of scientific rigor and to provide benefit to those who need to use the knowledge. In other words, this can be the patients themselves, it can be doctors who have to act on new evidence, it can be policymakers who have to put things into place to allow these better outcomes to take place. And to also at the same time develop knowledge that will not just be applicable to you and the team and the people that have come together as partners for this particular project, but to create something more generalizable that others can use as well. And that's what makes it real research. So taking this into consideration, remember that scientific rigor should never be sacrificed. Participatory research is as rigorous as any other. Just because patients or community members or anyone else are involved as co-researchers, you still do as rigorous as research as anywhere else. And one of the biggest systematic reviews of community-based participatory research in the early 2000s really demonstrated that the strongest participatory projects were also the most scientifically rigorous. So it's very important. So that what they're trying to say there is those that really did involvement really well also did the science very well. And also that participatory research is an approach to research as opposed to a methodology. So you can do any type of research this way. It's not just for qualitative research or for quantitative research. You can do randomized control trials in this way. You can do open-ended qualitative research in this way. Any type of research can be done participatorily. So it's not about the research methods, it's about the form of engagement and the decision making. So some basic participatory or PPI principles include that all partners are experts, but experts with different experiences. So it doesn't mean that everyone's a methods expert or a stats expert or a randomized control trial expert, but everyone brings some expert knowledge to the table. One thing that undisputably patients bring as they're the undisputed experts of living with that condition or living with that disease. Carers bring the undisputed expertise of knowing more than anyone else about what it's like to care for people with that condition or disease or living through that situation. No one else does. The doctors, the researchers, the managers, the policymakers, nobody else has that level of expertise. So everyone brings something specific to the table that only they are the experts in. And altogether, the project will be richer than if you exclude any of those particular stakeholders. Another thing that's very important is that there are power differentials between when people come together, people have different perceived or real powers. And there's a power imbalance, and some people feel very uncomfortable, and some people feel that they can't contribute the same way as other people can. It's very important that these things are acknowledged and addressed. And that really allows everyone to work together. And within a participatory process, there are actually means and methods for actually dealing with this in a way that that's equitable and allows to level the playing field and allows everyone to feel very safe, very inclusive, very included, and very comfortable in actually contributing, regardless of what their backgrounds are, what other issues there might be or other relationships there might be. So it's very important because there's lots of research that's been done about when people come together, if these things aren't addressed, sometimes the voices that might be the most important to hear from are actually sometimes silenced because they're afraid to talk. So we put things in place that really help encourage openness and safety and the ability of everyone to contribute in a way that's going to maximize the benefit of them being there. It's very important that all stakeholders discuss potential harms as well as the potential benefits of the research. This is sometimes something that doesn't happen when the end beneficiaries or the patients or carers or members of the community where the research is taking place aren't involved. It's a capacity building process for everyone. In other words, everyone's going to learn something from this, and everyone is going to come out of this stronger at the end. So participatory research, or PPI research, involves all stakeholders, those who will use or be affected by the results of the research. So because they're all involved in the research process, all the way from the beginning, from formulating the questions, through interpretation, through dissemination, therefore, by including all these stakeholders, the translation of knowledge into action is built into the research process, because the intended users, those who are actually the audience for what's going to come out of the research at the end, are actually members of the research team and are doing the research themselves. So that thing that we would have to do at the end of normal research, of getting the message out, is sort of integrated into the research process, because the audience, or members who represent the wider audience, are part of the research team. And therefore, it greatly increases the likelihood of the uptake of evidence into action. And it also greatly increases the relevance of the research to the intended users, because you're going to be, from the beginning, defining what your real needs are and helping to contribute to the priority setting that makes sure we're doing research on something that's important to you, as opposed to just research taking place and maybe it is or it isn't. And it also reduces what I like to call end of grant surprises, which are things like if researchers that have gone 5 years doing a particular research project, and then at the end they find out it's not as relevant as they thought it would have been for something that's of particular need to that particular community or population. So that's it for now. That's a general, just very high level overview of what public and patient involvement research is and how we've approached it through our efforts with the PPI research unit at UL, and more broadly, even through this new emerging network across all of Ireland for public and patient involvement. As we're developing what PPI means in the Irish context, and we want to take it a step further than how it's been put into policy and practice in the UK, try to assure that it's meaningful involvement. It's never tokenistic involvement. It's not just patients being involved to check a box or because the policy says that they have to be, but really making sure that we're training up people, researchers, and anyone else who's involved in health research to meaningfully involve patients, carers, community members in ways that will have an impact not just on the results, but on actually the way that the research takes place. And hopefully through that, it becomes a lot more relevant to everyone. Thank you very much.